Assalamu alaikum and welcome to Medicower. I'm your host Rabina Mir. I'm here to tell you about things that might be useful for your health, and hopefully today we're going to be learning lots of things about what happens when you visit the doctor's surgery and all those little tests that they do, from blood tests to urine tests and all the things in between. And I'm really pleased to welcome back Liz, Dr. Liz. Welcome and thank you for coming back to Medicower.
Pleasure.
So we're going to go through quite a few things today regarding all those little tests that the doctors do, so that we get a better understanding of actually what they're about and why you might do them.
I think a lot of people are quite apprehensive and quite worried if the doctor says, oh, we need to do some tests. I think they always fear something dreadful is going to be found. But it's also very useful to find a completely normal result as well.
So quite reassuring.
Definitely, yeah. So I think the doctor can, first of all, has to ask questions, has to understand how you're feeling. And obviously the doctor may well have to examine you, which, depending on where the problem is, can be from top to toe. And he'll use various instruments, stethoscope to listen to your chest, a blood pressure machine to check your blood pressure. I mean, there's loads of tests, aren't there? But then, to be absolutely accurate, or perhaps if there's a problem in really knowing what's going on, the doctor may say, I think we need to do some special tests. And probably one of the most common of those is to do a blood test.
Yes, we get a lot of those.
Yeah, because looking at somebody's blood test results can show a great deal. And in fact, I think most people will know probably what goes on, but we do have a photograph of somebody having a blood test. And I think people are often put off when they see the red blood coming into the tube, so most people tend not to look. I think people are quite apprehensive it's going to hurt, whereas actually it really is over in a shot.
You know, many years ago I was trained to take blood for people who were being screened for sickle cell and thalassemia. And I remember when I was being taught to do this, some of the techniques that the phlebotomist taught me.
Phlebotomist, now that's a very important word.
That's the word of that's the person who
takes
the blood.
That's exactly right, yeah.
And I only did venous blood samples, so just from the vein. But I do remember some of the techniques that they taught me, which actually made it hurt less. And I think one of the things that I used to say when I was taking blood from someone, to say, take a deep breath in if they're particularly anxious. I tried to keep them talking so that they weren't getting tense. And then I'd stretch the skin ever so slightly before sliding that. What worries me is about some of our phlebotomists, they say it's sharp scratch and then it's straight in, and there's not that delicacy as that we hope for sometimes.
Some people have really easy veins, and taking blood is absolutely a piece of cake. And as you can see from our photograph that we had, there is a tight band that goes, which does mean that the vein will stand out more and make it an easier target. So, especially for these people who are taking blood regularly, they have a lot of experience. So the person who says, as you said, a sharp scratching in, it may well be that they know exactly what they're doing, and so they're just going to do it quickly and efficiently. But everybody's different, aren't they?
And I think it's important to tell you, the person who's taking your blood, if you're worried about it. Because I know when people used to tell me, it made me rethink about how I needed to do that procedure so that they were as relaxed as possible.
I mean, I have known some people who find when they have their blood taken, it does make them feel as if they're going to faint. And that's quite common. That's just the way that person is. But if you know that, then you can prepare for that. So perhaps you could even get them to lie on the bed in the doctor's surgery, so that if they feel lightheaded, they're not worried about falling over.
So they really need to tell that person,
definitely.
This is how I can feel.
And it's very, very common. People shouldn't be frightened. I suppose the more tests you have, the less frightened you become, because you're used to it.
Hopefully.
But, so anyway, we have our patient.
But before you tell me about the actual details of the blood test, what I wanted to ask about was, lots of our community worry about the quantity of blood that they take, especially if they're taking more than one vial or bottle of it. So how much blood do they take when they do these tests?
Right. Well, the answer to that is how many tests are they doing in one go? So they may be looking for, I'm going to talk about what they'll be looking for, but they may be checking for 4 or 5 different things in one go. Well, Rabina, would you rather have one needle that takes all the blood in one go, or do you want 5 separate pricks? So depending on the number of tests, and also depending on the tests they're doing, because some tests do need slightly more blood than others, so it will vary. So I can't give you a definite answer,
No,
how
I
much
guess
blood
what I'm
they're
trying
going
to
to take.
get at, because I think from a patient's perspective, you're looking at those vials and those bottles and you're thinking, is that too much blood they're taking out?
No.
And I think we misunderstand how minimal amount they are
Exactly.
taking. But it looks, because they're long, they look more maybe.
And I think really that I've never ever known, it would be ridiculous, it would never happen that anybody would do so many blood tests, you would have a serious problem or be anemic at the end of it. No.
Because there's only, what, a mil or two in those vials? Those bottles are just long, aren't they? Yeah.
But the thing is, if you're having 2 or 3 tests done, and usually we do more than one test in one go, you can think, oh my goodness, look at all those tubes. But no, absolutely, that isn't anything to fear.
I didn't think it was, but I thought it was important to ask the question. Okay. So let's talk about what you're testing the blood for.
Right, well, I thought I would give you, for instance, a patient who came to see me quite recently, nice lady, and said, I don't know what's wrong, but I'm feeling really tired. I've no energy. I don't want to get up in the morning. I'm almost falling asleep in the middle of the afternoon. I'm still eating. I'm still doing what I should do, but I just feel weary. And I've asked various questions, which I won't go into now, but perhaps I'm beginning to wonder, could that person have something called anemia?
Right.
And anemia is usually when there's not enough iron in your blood.
Okay.
So one of the best tests I can possibly do is a blood test to measure various things, one of which would be to look at the red blood cells. And I think we've hopefully got a picture here of some red blood cells.
Oh, there we go.
Now, they look amazing, don't they?
They look like donuts without holes.
Absolutely. They look like it's like a ball that's sunk in the middle.
Yeah.
And that is a photograph that's been enlarged thousands of times because obviously red blood cells are really tiny. Yeah. And the important thing about red blood cells is that they carry iron with them and they have oxygen in them.
Okay.
And so if we don't have enough iron in our blood, then our red blood cells aren't going to be as healthy as they should be, and we will be anemic.
So that's where the tiredness comes in, is it?
The tiredness from that.
Yeah.
And one of the commonest causes is if people don't eat iron in their diet. So, for instance, if somebody is vegetarian and doesn't have any meat, and there's a lot of iron in green vegetables, nothing like as much as in red meat. I should emphasise red meat because white meat, like for instance chicken or fish, does not contain as much iron as red meat.
So we're talking about lamb, mutton, beef.
Yeah, all those sorts of things, but there are also other reasons why you might not have enough iron in your blood. For instance, somebody who has a stomach ulcer and the stomach ulcer is bleeding. So if you had really, really dreadful piles, so it would be very unusual if your piles were really bad and you were bleeding from your piles to become anemic.
Because you're losing blood too often.
Yeah, and one of the most common reasons I find is ladies who have heavy menstruation, heavy menses, heavy periods. Yeah. If they're losing a lot of blood with each period, or sometimes not having just a regular monthly bleed, but it's happening more than that, they can become anemic simply as a result of these heavy periods or menstruations. And so obviously the treatment isn't just, can I give you some more iron? It would be, I need to know if you've got a stomach ulcer. I need to know if you have heavy periods so that I can treat it.
Okay.
So
the blood test is going to check for the iron level?
The iron level, yes. Another thing, when we have a full blood count done, we're looking at the white blood cells, and I thought you might like to see what a white blood cell looks like. So we've got some pictures here of blood, and there's some red blood cells there, and there's some white blood cells. So if you look, this is a different sort of a picture. Those little red blobs with the white bit in the middle, you can imagine that's a red blood cell. But those purpley ones, which are a lot bigger than the red blood cells, with that darker middle, those are white blood cells.
So why are they purple?
Just because they've taken up different sorts of dye. We use different dyes to stain them. So that's why those are purple. And white blood cells, let's think about what white blood cells do. White blood cells are our way of fighting off infections.
Ah, the soldiers that fight infections.
So, a good way to say it. So if you had a bad chest, if you've got a chest infection, if you have a water infection, if you've got, for instance, a nasty boil or an abscess, your body tries to fight that and the number of white blood cells increase. So we make more white blood cells to very quickly mount an attack on those germs.
I see.
So one of the things you can also count is, have you got the normal number of white blood cells? Or if you were suspecting a water infection or something, we would expect again to see a higher number of white blood cells.
So this blood test is helping you to recognise whether there's something going on inside the blood that's going to link to ill health.
Yes, exactly.
And that increase in white blood cells is telling you, yes, there is an infection in the body somewhere.
One of the most common causes of a raised white blood. Now, obviously, Rubina, there are all sorts of things that can cause any of the things we're going to talk about, but I'm really highlighting the most common things.
Okay.
You mentioned, or rather I think I'd mentioned about anemia, and I said that a low iron is a form of anemia. In other words, blood that's not so strong.
But there's different types of anemia, aren't there?
Absolutely right. So iron is one of the most common, but if you have a deficiency of vitamin B12, or a deficiency of something called folic acid, that will also cause a problem with anemia, because a healthy red blood cell needs the right amount of vitamin B12 and also the right amount of folic acid.
Okay.
And if they don't have the right amount of those, the blood cells sort of swell.
Okay.
So we can see two things. When we look down the microscope at the red blood cells look bigger than we'd normally expect.
Okay.
But also we can do a specific blood test to measure how much vitamin B12 is there in the body and how much folic acid is in the body.
So folic acid we often think about in relation to women who want to start having a family.
That's right, pregnancy.
And you know, are wanting to get pregnant, and that's the time that they're often taking it, aren't they?
Well, all ladies who want to get pregnant should ideally start folic acid before they start to try to get pregnant, and then during the course of the pregnancy. And basically this is so that we have a healthy, normal baby.
So what about those that are not thinking about pregnancy? It's nothing to, we still need folic acid in the system.
We do, and folic acid comes from the food we eat, really. So it's important that if you don't have enough from your diet, you can get folic acid tablets. And for some people it might not be something they need to take forever. Once they've boosted their supply and their storage of folic acid, then that's fine.
So which foods might we find folic acid? I think is it the dark green vegetables, things like that?
You know, you're making me think there, but I think you're right.
I'm trying to wrap my brain. I think it might be, but you might want to check that.
I think everybody, oh dear,
just check
you
that.
found us out. We'll have to do some homework.
I think it's the dark green vegetables,
And then the other thing is vitamin B12. That's something that, in fact, you can't give as a tablet. The only way you can give somebody the vitamin B12 is actually via an injection.
Yes, I know about those because I don't absorb vitamin B12 from my diet, and I know I have to have those every 3 months.
Yeah, so you have injections.
Yes.
And are they painful?
They are painful. They're intramuscular, so they're into the muscle. They don't last very long, but they are painful. I find them painful.
But important, because otherwise you would not feel as well.
Yeah, and I know when I don't have it, my energy levels change, and when I'm late with my injections, I can feel a difference in my energy levels.
I hear a lot of people say that. So important to think about different sorts of anemia, not just the iron deficient anemia.
So this is another thing that one blood test is helping us with?
Well, no, that one sample will only tell us about the red blood cells and the white blood cells.
Okay.
If we want to measure the vitamin B12 or folate, or both, probably we usually do both, you would need an extra bottle of blood.
So when they say full blood count, is that what they're talking about?
No, a full blood count would just be measuring red blood cells and white blood cells.
Oh, okay, okay.
And what I didn't really mention is that to be sure somebody has an iron deficient anemia, we can actually do another test which will look at how much iron is in the blood.
Okay.
And we really need that to be 100% certain that it is an iron deficiency anemia.
I know when I was young and we used to worry about being iron deficiency anemia was one of the things that I don't know, it was a common topic amongst the friends that I had, and we were constantly looking on the inside of our eyelid because we were told that if it wasn't bright red and it was a pale pink, are you going to look in my eyes? Then it
look up at the ceiling.
Up at the ceiling.
You look fine. Actually, it's not really a very good test.
No, well, that's why I'm asking you.
No, I mean, you really have to be very, very anemic for that to look pale. So, yes, we do it. Perhaps not as much nowadays as we used to, but it's not a particularly good test. So we would need to back that up with doing a blood test as well.
Okay. But actually, what we want to be encouraging our viewers to think about is the diets, don't we? Where the sources of iron come from. So we talked about red meat, but actually there's lots of other ingredients in our food.
Do you know what's amazing? I never cease to be amazed. Apricots.
Yes.
Apricots have a huge amount of iron in them.
I once had a dietitian say to me, if you combined apricots with almonds, you got your daily intake. But then other dietitians have not agreed with that, so I'm not sure about that anymore.
I don't know about almonds.
No, I don't.
do know, and also how many have you got to have your daily intake? You know, you need a bucket full of apricots.
Yeah, exactly. It's quantity that you have to think about. But I certainly know the dark lentils that we have, the dark green lentils, are rich in iron.
Oh, right.
Baked beans have iron in, I believe.
I didn't know that.
I think egg yolk, they carry iron, don't they? You're saying, well, I'm sure I'm right on these things.
I think we need to do some homework.
A dietitian to check this.
We need a dietitian.
We need a dietitian.
Where's a dietitian when you need one?
So it is important to look into those things. I think if you were to go into websites, look at the World Health Organization's food food model, whatever.
You can just Google it. Food with iron. Yeah. Food with vitamin B12. You'll find it.
There's some homework for everybody to take home. Yeah. Okay. So we're looking at the blood test because these are things we're looking at in terms of iron deficiency, because that can lead to being really tired. It's one of the symptoms. So that's why those blood tests are relevant.
Absolutely.
And also we're looking for infections with that blood test as well.
Yeah.
What else are you testing us for?
Well, I mean, there's so many, and this is in no order, but one of the very common blood tests might be to measure the amount of glucose or sugar in your blood.
Okay.
And that obviously is tied in with thinking about diabetes. So there are various ways we can measure the blood sugar. We might, for instance, want to measure the actual amount of sugar in the blood at that moment in time. So we might ask somebody to have a fasting blood test, which means you've not eaten for probably about 10 hours. We could just do a blood sugar on somebody any time of the day. It doesn't matter if they've just eaten or if they haven't eaten for 1 hour or 3 hours.
Sure.
So that will tell us exactly how much blood sugar is there at that moment. And that may be very useful to know if that person actually has diabetes. The other test we have is a test that we can use to either diagnose diabetes, or we can use as a measure of how well controlled somebody's diabetes is. And that's a special test with a funny name called an hasb-e-haal. People may well know these. And that gives us a very accurate way of knowing how much glucose or sugar has been in the bloodstream for the past 90 days.
I think you've talked about that on our show about diabetes.
But it may well still be something people haven't heard of. And obviously, if somebody has diabetes, we need to know, hence the diagnosis. But also, if somebody has diabetes, we want to check they're taking the right treatment, it's working well, the food they're eating they're doing well with it. Because it may be, as time goes on, diabetes will usually get worse. People may need more treatments or new treatments added.
Okay.
So, common blood test, doing a blood glucose or blood sugar, same thing. Just as a matter as well, just to say, people who have diabetes can do a very quick prick of their finger, and that will tell them what their blood sugar is at that moment in time. So we can either take it from the arm, as we saw with our photograph, or we can do it as a finger prick.
Okay. Any other blood tests we need to talk about? Shall we move on to the next category?
Well, no, I think just very quickly, let's mention about We want to do a test to measure that the minerals are at the right balance and therefore that people's kidneys are working well.
Okay.
Because kidneys are a really, really important organ in our body. They're responsible for getting rid of the waste products.
Sure.
So if we're not getting rid of the rubbish, we're not going to feel well. And the kidneys maintain a balance of the acid in our blood and very often are involved in the right balance of vitamins and minerals.
We've got 2 kidneys. Do they both do the same job?
They do, and actually, although we have 2, you don't actually need 2 kidneys as long as you've got 1 healthy kidney. So my dad had one of his kidneys taken out when he was only 23 and he lived to be 80 something. So 1 healthy kidney can do the job of 2.
No, I've got a friend that's got only 1 kidney that's working well.
Yeah.
Okay.
But a very important organ, so we do need to monitor how well it's working. And as you get older, just as you get old and wrinkled on the outside, your kidneys will get old. So we need to check how well they're working. And also other conditions, like for instance, here we go again, diabetes can affect the kidneys. Certain drugs will only work well if the kidneys are functioning normally.
Yeah, I've got a note here that says the effect of certain tablets on kidneys, and I guess that's what you're coming to talk about.
Well, it's almost in a way the other side of it. If your kidneys aren't working well, then the tablets won't work as well either.
Oh, I see. Okay.
So there's 2 sides to that story.
So these aren't necessarily things that you would have symptoms for, though, are they?
No, very often no symptoms, but as part of a general checkup for somebody where you're not quite sure what's going on, but there's definitely something going on, we want the fullest possible picture we can get. Another very useful test for that sort of patient where they're not well and we're not sure is to check that their liver is functioning properly.
What does the liver do then?
Well, basically, it makes quite a lot of very useful compounds and it also gets rid of a lot of other things.
Okay.
And we store glucose in our liver.
Okay.
So, for instance, you've heard of people having gallstones and we need bile to digest. So that's going on in the liver. If we put a lot of weight on, then we get a lot of fat, not just on the outside, but the fat can get crushed into the liver and therefore the liver won't work as well.
Okay.
Certain drugs will affect how the liver works, so important to make sure that the liver's working well. People who perhaps drink more alcohol than they should, that will affect how the liver works. You can get infections, hepatitis, which is an infection specifically for the liver, hepatitis A, hepatitis B, hepatitis C, which can cause really very severe problems with the liver. So an important test to do.
You've made me also remember when you've talked about the liver that the liver, I'm pretty sure, is one of those meats that carries a lot of iron, which is why people are encouraged to eat it. You're not going to have that.
I'm just fascinated, thank you.
I'm remembering all the things that dietitians have told me over the years, and I think I'm right about the iron being in liver.
I can imagine there'd be a high content of
iron in liver. Okay, we're coming up to the break, so we're going to have to come back and finish this fascinating conversation. We've got lots more to talk about, I know, about tests at the doctors. So hopefully we'll see you soon, inshallah. Assalamu alaikum wa rahmatullah.